Good morning, Naoko.
As Milka mentioned, my name is Naoko Doi. I'm the team lead for market access at Japaigo, which is the lead implementer for the UNITAID-funded AMPLI-PPHI project. I'll be introducing the project really briefly before handing it over to Mutsumi to present on today's feature content. So AMPLI-PPHI is a UNITAID-funded 4-year project led by Japaigo in partnership with PASS and FIGO that aims to accelerate the adoption and scale up of heat-stable carbetocin and advanced distribution of misoprostol for PPH prevention and tranexamic acid for PPH management in order to reduce maternal mortality and morbidity from postpartum hemorrhage. Launched in August 2022, the project works to generate evidence on the feasibility, acceptability, and cost effectiveness of these new and newly recommended PPH drugs and service delivery model across varying health settings. Secondly, create enabling environment for scale up through policy development, advocacy, community engagement, as well as integration of these drugs into health systems. And then as a third pillar, help improve affordability and achieve sustained availability of these drugs in the LMIC market. The project is implemented in 4 countries, Guinea, Kenya, DRC, and India, and then also work with 13 additional countries to share evidence and lessons learned, encourage cross-learning, and support advocacy for the adoption and use of these drugs. So as part of the third pillar of the work to help improve affordability and sustain availability of these drugs, AMPLI-PPHI developed a business case for heat-stable carbetocin, tranexamic acid, and misoprostol. So now my colleague from PASS, Mutsumi Metzler, who led this work, will present on this business case. So take it away, Mutsumi.
Yeah. Thank you so much, Naoko. So as Naoko said, AMPLI-PPHI, especially a commodity access team, put this business together last year, toward the end of last year. So 2 objectives we have in mind. One of them is we wanted to provide overall picture of the current market landscape for heat-stable carbetocin, or HSC, and tranexamic acid, or TXA, and also a misoprostol. And then by doing so, we wanted to highlight barriers and opportunities for expanded access to the quality assured products. And we are hoping that the stakeholders, such as donors, government, and also NGOs, will be able to use recommendations from the business case to prioritize their investment and also develop their investment plans and activity plans. And also we are hoping that donor organizations and NGOs who are currently working with manufacturers of these 3 drugs to use information from business case, such as market size, to create tailored business case together with the manufacturers. So that was objectives of the business case. And just going through a few points, because the business case we will present today include market size and other information. So data source we used mostly come from secondary data, as well as the data from the AMPLI-PPHI pricing and availability survey, which was conducted by the team between June and July last year. So the team in 4 countries listed there visited about 260 health facilities and pharmacies to check the pricing of the 3 products, as well as stock availability of those products. And so those data, especially country-specific data, are primarily used for this business case. And also, I want to share the definitions of two words we used throughout this presentation. So one of them is quality assured products. So that means products approved by stringent regulatory authority or pre-qualified by WHO. So as you might know, bilateral, multilateral organizations that provide funding or support for programming and commodity procurement also develop global policy and guidelines for maternal health, use product, quality assured product as defined as drugs either approved by stringent regulatory bodies or pre-qualified by WHO. So the definition we use, what we wanted to be consistent with the definition used by these organizations. And the other term we used is total addressable market. And total addressable market, or TAM or TAM, represents the market size when an entire market for intervention or product is reached. And TAM does not consider any access restrictions, such as affordability, level of funding or availability of funding, or status of regulatory approval, or policy and guidelines, and also geographical constraints or competition. So therefore, TAM is pretty much estimate of the most optimal situation or most ideal situation for a product or an intervention. And also in terms of products, especially you will see in the market size, quantities or cases, a number of quantities or cases. So we used this assumption to calculate product quantities. So for example, like heat-stable carbetocin or HSC, 1 ampule or vial, which is 1 milliampule vial, that containing like 100 microgram of HSC is a one product quantity. And PPH prevention requires 100 micrograms of HSC. So the one case, PPH prevention case includes one quantity of HSC. So this assumption similar to misoprostol and TXA. So misoprostol 3 tablets of 200 micrograms will be one case for PPH prevention and 4 tablets for PPH treatment case. And as you can see, the calculation for TXA as well. And another thing I wanted to mention is the algorithm we used to estimate time for both PPH prevention and also a treatment. So we started with the number of live birth, which is the denominator we use. And for non-facility birth, we assumed that misoprostol would be used regardless whether birth is assisted by the skilled birth attendants or not. And for a facility birth, if birth are assisted by skilled birth attendants, we assumed that HSC will be used. And if birth are not assisted by skilled birth attendants, we assume the misoprostol will be used. So a couple of things I would like to know is that, uterotonics can be used for stillbirth. So it might be more appropriate to use number of deliveries rather than live birth. But the lack of data for a number of deliveries, we use the live birth in time estimate. And also HSC used for facility birth assisted by skilled birth attendants. Some countries may still use oxytocin, but again, TAM is the most ideal case for a product. So we assumed that HSC will be used for facility birth assisted by skilled birth attendants. And for a PPH treatment, non-facility birth, we assume the misoprostol will be used, but no TXA will be used. And for facility birth assisted by skilled birth attendants, we assume the oxytocin as well as TXA will be used. And if birth are not assisted by skilled birth attendants, misoprostol will be used without TXA. So those are the algorithms we used for estimating the time. So, so in order to develop business case for the three products, we first think about what's the sort of like a global movements or national responses to PPH burden, because that's pretty much influencing market size or TAM. So probably many of you attending this webinar are already aware these global movements, but just going through quickly, as we know, e-motive study completed and also positive outcome comes out of that. And because of that, WHO issued a recommendation at the end of the last year, and WHO recommending a treatment care bundle as well as use of objective blood loss measurement device. And also UNITAID is funding two clinical trials. One of them is a clinical trial to evaluate intramuscular route for TXA for administration. And the other one is to evaluate heat-stable carbetocin for use for PPH treatment as well as PPH prevention. So if this clinical trial will generate a positive result, and then that would be probably most likely affect the market sizing in the future. And also at the middle of last year, WHO issued roadmap to combat postpartum hemorrhage between 2023 and 2030. And the roadmap called for investments into critical areas of health system, with a focus on LMICs. And also funding to support drug availability, adoption, and use have been increasing. So I think you probably heard of USP's landscape presentation before, and also they recently published a white paper on that. And USP landscape, the manufacturers of reproductive and maternal health products, including TXA and also misoprostol, and they identified one TXA manufacturer and one misoprostol manufacturer in Sub-Saharan Africa. And the Concept Foundation also landscaped the TXA product manufacturers globally and identified several of them. And as we all know, Ferring, which is a manufacturer of the only WHO pre-qualified HSC right now, is very much committed to provide the product at 31 cents to LMICs. And also funding side, UNFPA providing funding for new and lesser use supplies that include HSC and also TXA, and contingent upon the countries will develop introduction plans and also quantifications for those products. And very much recently, we heard the announcement of a joint venture between UNITAID and the UNFPA, and then they will work together with health authorities in 5 African countries and partners in the communities to overcome barriers that limiting access to life-saving solutions and the medicines. And implementation side, in addition to the AMPLI-PPHI project funded by UNITAID, our HSC Maternal Health Supplies Caucus last year announced small grants to support the programs endorsed by government to catalyze activities to increase access to new and lesser used medicines. And also Concept Foundation has been supporting registration of HSC in LMICs. So a lot of global movements happening, especially recent years. And at the country level, so this is examples from 4 key countries of AMPLI-PPHI, and Kenya made quite a bit of progress, especially last year. And KEMSA, the procurement agency in Kenya, included 360 doses of HSC in the direct procurement, and also budget for that has been allocated from the national government. And also UNFPA confirmed availability of resource to purchase PPH health products. And similar things started to happen in DRC, and DRC is working to doing a quantification for HSC and also TXA, and they discussed introduction plans, and then they're targeting 7 provinces initially, and they are very much willing to expand the access to those drugs in 26 provinces by 2030. And India is a little bit less advanced compared to Kenya or DRC, but they have been working very closely with the government authorities to really for introduction or increase availability of 3 drugs in those 2 countries. So given those environment changes happening in recent years. So what's the situation for tranexamic acid, misoprostol, and also HSC? So tranexamic acid or TXA availability, as you all know, currently there is no tranexamic acid pre-qualified by WHO for PPH indication for use. And however, there are many SRA approved tranexamic acid. We identified 46 products last year by doing secondary research. And also USP identified 1 TXA manufacturer located in Kenya. So so registration-wise, many or non-SRA or quality assured products are registered in 4 key countries of AMPLI-PPHI, but pretty much the registration of SRA approved TXA is very much limited. So, and also in the pricing and availability survey, when we check the facility level stock availability, in India and Kenya, stock availability at the facility level, not great, but not, it's pretty decent. However, DRC and especially Guinea, stock availability at the facility level is extremely limited. And also pricing. So comparing 4 key countries, its pricing is widely different. And as you can see in the graph on the left side, the pricing in DRC and Guinea that we observed for TXA are higher than pricing we observed in India or Kenya. And also what's the difference in terms of procurement pricing of, by facility for quality assured products and non-quality assured products. So the graph on the right side is 1 example from DRC. And so for the non-quality assured TXA were available in public and also NGO or faith-based organization health facilities. And quality assured TXA was available only in private health facilities in our pricing availability survey. So this graph is not really apple to apple comparison, as you probably noticed, because facility types are different. However, you can see a little bit of a trend that quality assured TXA pricing of that is higher than that of non-quality assured products. And so this is our TAM estimate for tranexamic acid. So we estimated at TAM, that's again ideal situation for an intervention product. We estimated about 40 million quantities will be for market size for TXA. But if looking at based on the indication for use, half of the market size coming from other indication for use, but adding PPH treatment indication, basically the TAM estimate will become double. So the PPH indication for TXL is a growth potential. And looking at the geographical difference, LMICs, for example, like East Asia Pacific, South Asia, and also Sub-Saharan Africa has a growth potential. So based on those informations, we recommendation for TXA is require targeted investment effort to increase affordability and the availability of quality assured TX products at the facility level, especially for use in PPH treatment. So as you know, so a lot of global momentum or funding support now going into our national governments to increase adoption, availability and the use of TXA. So it really makes sense to leverage those global momentum and the funding support. And then also investment decisions. So donors, those decisions are focusing on improving availability of quality assured TXA more of a global level. It's good to focus on country level adoption of TXA. For example, focusing on adoption of a quality assured TXA as a PPH treatment by including the product into a national EML or procurement list. And also at the facility level, especially focusing on proper use of quality assured product for a PPH treatment. And then continue to advocate for use of, again, quality assured TXA products for PPH treatment, in addition to other indication for use, because especially TXA is a pretty new a recommendation for a PPH treatment. So we needed to continue to make efforts to advocate for the product for that indication for use. So misoprostol present a different picture compared to tranexamic acid. So there are currently 5 pre-qualified misoprostol products pre-qualified by WHO. And also we identified 7 misoprostol products approved by stringent regulatory body. And again, USP landscape identified 1 misoprostol manufacturers in Nigeria. So even looking at the registration status of products at in 4 countries, we found quality assured products are registered in those 4 countries. So in terms of registration, so quality assured products are available. However, when we looked at the facility level stock availability, that presents slightly different picture. So misoprostol is very well stocked in AMPLI-PPHI surveyed sites in India and Kenya, as you can see in the graph on the right side. But again, it's limited in DRC and also Guinea. And also registration of quality assured products are in key countries. However, stock availability at the facility level of quality assured products is limited. And Guinea and Kenya, I think we saw more than 27 surveyed sites had 20% of surveyed sites had a stock availability of misoprostol. But again, other countries is very limited in terms of availability of quality assured products. And also pricing, it's similar to a TXA pricing, procurement price by facility, different depending on the country. And, India and the DRC pricing, procurement price by facility of misoprostol lower than Guinea, Kenya, and especially we observed the higher pricing in Guinea. And again, comparing procurement price by facility between quality assured products and non-quality assured products, we observed pricing of quality assured products are higher. Especially looking at the private health facilities, the difference in pricing between quality assured and non-quality assured products are more significant compared to the other two facility types. So in terms of TAM estimate, we estimated TAM for misoprostol will be about 600 million quantities. However, TAM for misoprostol for PPH indication, both prevention and treatment, will be a very small portion, about 20% of TAM. So this presents a challenge when talking about especially manufacturers to increase availability of misoprostol for that indication for use, because especially considering that countries are, promoting or advocating for facility-based birth, misoprostol in use in community birth will probably decreasing. So, misoprostol for PPH indication for use, we could probably safely say that will be decreasing in the future. And looking at the geographical difference, South Asia and Sub-Saharan Africa represent a larger portion of TAM. So a recommendation for misoprostol, we think that it requires targeted investment effort to improve availability, affordability of, again, quality assured products in facilities and the communities where injectable uretrogenics cannot be used. So especially looking at misoprostol for PPH prevention and treatment will represent a smaller portion of TAM. So it's really required to collaborate with family planning, donor organization or NGO to really promote the comprehensive role of misoprostol, meaning that misoprostol for all indication for use, including not only for PPH, but also medical abortion as well. And also focusing on country level procurement of quality assured misoprostol continually. And especially, there are 5 products which are already pre-qualified by WHO. So it makes sense to work with manufacturers of those products and work with them to really, so they will participate in the national tenders and also improve affordability of their quality assured misoprostol, and also continue to facilitate a stable market for quality assured misoprostol through existing global coordination mechanisms such as RHSC visibility and analytics network. So regarding heat stable carbetocin, as you already know that there's only one pre-qualified, one product pre-qualified by WHO and also approved by SRA which is Ferring's HSC. And Ferring products is currently registered 15 LMICs, and then Ferring is making efforts to increase the number of countries where the product is registered. And also during the AMPLI-PPHI project, we identified there are a few other HSC products which are not Ferring's products available in India, and those products are also manufacturers in India. So that was a pretty surprise to us. Talking about facility level stock availability, so quality assured products availability as well as availability of HSC is pretty much limited. We saw that in India, HSC available in 14 surveyed sites, and those are mostly NGO and also private facilities, and as well as pharmacies. And of those 14 sites, 6 sites had a Ferring's product. So that means the remaining 7 had non-Ferring products, HSC products. And in Kenya, HSC was available at the time of the survey in only 4 health facilities. So those are 1 public, 2 private, and also 1 NGO or faith-based organization health facilities. And we didn't observe any stock availability of HSC either in DRC or Guinea. And also our pricing availability survey included oxytocin as well. So oxytocin is really well stocked at facility level at the time of a survey. It's very much more than 90% in DRC and Kenya. India is a little bit lower, but we can say that oxytocin is well stocked at the facility level. So that situation can present a positive picture for HSC because that provide a potential market potential for heat-stable carbetocin in the future. So however, the pricing of heat-stable carbetocin is an issue. As I mentioned, Ferring is committed to provide HSC at 31 cents to LMICs, but looking at the facility procurement price, that would be a lot higher than 31 cents. Of course, 31 cents is an ex-work price, and distribution costs, etc., needed to be added. But still, a lot of higher pricing we observed in Kenya. It's more than $15 in the public health facilities, and also NGO FUO facility that was more than $17. And in India, pricing of HSC is lower, but still it's more than $4 in private facilities, and that is higher pricing than a non-Ferring HSC. So, and that pricing compared to oxytocin procurement pricing by facility, as you can see in the graph in the right side, it's very high. So oxytocin, of course, non-quality assured products is lower pricing than compared to that of quality assured products, but even quality assured products pricing is a lot lower at the facility compared to HSC procurement pricing by facility. So regarding estimate for TAM, we estimated that TAM for HSC will be a little bit over 90 million ampules or vials, and also geographically LMICs like East Asia and the Pacific, South Asia, and also Sub-Saharan Africa present a larger portion of the TAM. So recommendation for HSC, we thought it would require targeted investment efforts to improve affordability of quality assured products in LMSs, and 90 quantity is estimated for TAM. So that potential market size could be a leverage to reduce the pricing of WHO pre-qualified product. And also, especially considering the current price difference between quality assured oxytocin and HSC, I think price reduction needed to be achieved in order for HSC to permeate into LMIC market. So how can we do that is going to be an issue. So the one idea, a potential idea, is to expand the market for multiple brands of HSC and currently available in Indian market if their quality is proven to be good, and also if those manufacturers can achieve either WHO pre-qualification or SRA approvals. So this is the end of my presentation, and again, TAM is the most ideal situation for those three products. And then, as you can see, that it's not really realistic. So this year, AMPLI-PPHI Community Access Team is planning to assess demand, which will present a more realistic market landscape, and also assessment of the demand for those three products. So that's what we are planning to do. So thank you so much for listening. And if there are any questions, we are happy to answer.
Thank you, Mutsumi, for this very thorough presentation. I'm sure that all of our participants really appreciate all the information. We have several questions, and Debbie Armbruster started the question period with wondering why misoprostol, other indications, does not include induction.
Right. So yes, we should, but it's just so we realized while doing the TAM estimate, it's very much difficult to understand the products by indication for use. And so I think we are planning to do this year, especially when we're doing demand estimate, how we can estimate the demand for not only misoprostol, but also TXA as well. How we can disaggregate demand by indication for use. So that's pretty much we are planning to do, and we are currently developing a methodology for that. But yes, I think we should include induction for misoprostol indication for use, but it was pretty much difficult for us to do at this point.
Thank you. Oleg Surov from Fering. Is there a plan for TXA to include PPH treatment into the label as an additional indication? Do you know anything about that?
For PPH treatment, as you said, right?
You said PPH treatment in the label.
Right. So when we did pricing and availability survey in 4 countries, some products already include PPH treatment in the labeling information for TXA. So, but the labeling for TXA is not consistent. Like, some includes PPH treatment, some don't. So I think effort needed to be done, not only just to raise awareness with the healthcare workers and the policymakers to make sure that TXA will be used. They know that TXA will be used for PPH treatment, but for labeling information also, include TXA treatment. That requires working with regulatory bodies at the country level as well.
Thank you, Mitsumi. We have a comment here saying that Pharynx Access Heat Stable Carbetocin is registered in 19 countries now,
Okay.
and 7 registrations are pending. Further submissions are planned. Then there's also price for the public sector is different from the private sector, which you cite. Public sector is 41 cents US dollar in the UNFPA catalog. As the public sector procurement is only starting, you don't see it yet in the market. Then there's Patrick Macaria, who's asking, does this assume the use of heat stable for prevention without considering oxytocin?
Right. So again, the term is presentation of a most ideal situation, right? So that's why we didn't include PPH prevention for oxytocin for the term estimate. But again, in reality, probably in some health facilities, some countries continue to use oxytocin for prevention. It's just a definition of term is really a most ideal situation for a product. That's why as a algorithm shows that HSC will be used for all facility, but assisted by SBA.
Okay, and I have a last comment here from Debbie Armbruster from USAID. I understand, Mutsumi, thank you. The other issue is that the dose is 25 mcg, and we really need to promote and procure 25 mcg tablets for induction. She's referring to misoprostol.
Okay, yeah, thank you so much.
All right, I don't see any more questions unless somebody wants to raise their hand. You can open your microphone. We still have a few minutes to go with the webinar. So questions, any questions are encouraged and welcomed. Okay. Final words, Naoko, Mutsumi.
Well, I just want to thank everyone for joining the webinar, and then also thank Mutsumi for the great work that she presented today, and congratulations again on your retirement, but we're going to miss you all.
Thank you so much for Naoko and also Yuka for your kind words. And I really miss all of you whom I worked over the actually 17 years at PATH, and that's very much, I appreciate that. Thank you.
Thank you, Mutsumi. All the best. And thank you very much for sharing all this knowledge. Great presentation. Lots of information. I'm sure people are going to go through your presentation with a fine-tooth comb and come back probably with more questions. If you have any questions, please do not hesitate to contact me at mdnev@rhsupplies.org. I'll make sure that either Naoko or Mutsumi will respond to any other questions. Thank you so much, and we'll see you soon in the Maternal Health Supplies Caucus meeting planned for April. All the best. Thank you. Have a good day.
Thank you.
Thank you.